Okay, hi, Dr. Eva. Welcome to the Genetic Genius podcast. I'm so excited to have you as a guest today.
Thank you. I'm excited too. And yeah, it's a great opportunity to let your listeners know more about rheumatoid arthritis and functional medicine, and that there are ways to work on the disease, even if it's a chronic one. So yeah.
Yay, I'm so excited. And for the people that are watching the video, I love your stack of books behind you. That's
Thank
great.
you.
That's so fun. I love the color coordinated and everything. I can tell my books too. We both have a passion for books.
That's true. Yeah.
Yeah. Before we dive deep in, I would love for you to just introduce yourself to our listeners, talk about what you do, what your passion is, your role here on our planet.
Okay. Yeah, my name is Dr. Eva Hasenbeck. I'm officially the first certified medical doctor in Germany who is certified with the Waltz Protocol and the Institute for Functional Medicine. I'm originally trained as an ophthalmologist, but because of my own health journey, I had Hashimoto's disease. I dig into functional medicine, and as soon as you know what you can do and how your body is possible to even heal from chronic diseases, you got addicted, and that's what's happening to me. And so I switched over 100% to functional medicine. And yeah, I mean, I see it in the practice all the time that I see people with RA or other autoimmune conditions. They have trouble working on their own health because they don't have the right information. And my goal and basically my passion is I believe that every person deserves the possibility to get all the information for their health so that they can finally work on their own health and activate the body's innate self-healing potential. And it's even possible to reverse symptoms with rheumatoid arthritis, like for example. And yeah, I see it as my role on this planet to spread the word, to get the message out that we reach as many people as possible, and they know that there is still some hope out there, despite the fact that they are on usually 4 to 5 different prescription meds. Yeah.
Yeah. Oh, yeah. That's such a great aspect that you explained about, the troubles, I would say, that people are having with different diseases, but especially with autoimmune disease. And I liked how you had, talked about your story being like the seed of your passion. Because I think a lot of us have that as naturopathic doctors or integrated physicians, where that is how we kind of get started,
Yeah.
helping people on their own journey, because it's our journey ourselves.
Yeah.
Wonderful. Can you talk a little bit about autoimmune disease for our listeners? Explain like what that is basically, what's happening in the body from that scientific perspective.
Yeah, so in conventional medicine, we see it like the body is attacking itself, and it's in different autoimmune conditions. For example, in my way, the Hashimoto's disease, it's the body producing antibodies against your tissues. And for rheumatoid arthritis, it's the joint tissue. So it attacks basically healthy joints and tissues and causing an overall inflammation. And this leads to joint damage or tissue damage in the thyroid. So the thyroid loses its function. And yeah. So.
Mm-hmm. Yeah. So the body is basically fighting against itself, a war against itself. And that's specifically the immune cells, or are there other systems of the body that come into play? Like you mentioned, like the thyroid and the joints. So you can have different parts of the body that are affected depending on the autoimmune disease.
Yeah, sure.
Mm-hmm.
Like I think almost every tissue. I don't know how many autoimmune conditions we already have
Right.
as in diagnosis, but there are like hundreds out there. And for MS patients, it's they are basically the myelin, like the sheets around every nerve cell. So yeah, and for I think the problem with autoimmune diseases, even when I got first diagnosed, which was I think he was 70-year-old, my ob-gyn, who diagnosed me with Hashimoto's disease. And he was like, yeah, it's your body attacking yourself. And I felt shocked. And I was like, okay, what did I do wrong? And why is this happening? I mean, this sounds really hard if you tell a patient that the body is working against it. But that's like one of the main reasons I try to explain all my patients that, of course, we like from a scientific side, we can see that the body is attacking tissues in itself, but it's only to protect itself. So for me, it's really important to mention this to every patient, that it's not that they did something wrong or that it was bad luck and something happens and now everything is worse. It's just the body loves the person who lives inside the body so much, I think, that it tries to protect the body. And the only way to do it is to create those antibodies, because they are like, they usually have a root cause. Like, you know that there's always an underlying cause why this happens in the body. So I think this is really important to tell people, that it's not that if you have an autoimmune disease, that it's going to be there for the rest of your life. We need to figure out why this happens in the first place. And this is another reason why I think it's so important that you're doing the podcast and we're trying to reach people out there, because usually conventional doctors never talk about it. They just say, like my doctor did many years ago, he said, yeah, you have to live with this condition for the rest of your life. There's nothing you can do. You just need to take your, in my case, thyroid medication, and every 6 months have your blood work done. But this is, I felt disempowered. And this is the worst thing that can happen for a person who has an autoimmune disease, because you need to activate this self-healing potential. And this is not possible if you think everything is total, like a total mess, and you can't do anything. So, yeah.
Yeah. Oh, that's key. You talked about so many great things. One, I loved how you said that it's the body's protection mechanism. And, you know, when patients have that autoimmune disease, they do have that first emotional feeling of like, what have I done wrong? Like you said, and that's so key. And for us to be able to explain to our patients and all the listeners that it's not your fault. It's just your body's, like you said, I love it, that protection mechanism, figuring out then that root cause that you talked about. Like, how can we figure out what went wrong, quote unquote, in the right, you know, in the system, in the communication, right? Communication breakdown. So that's great. And we'll dive a little bit deeper into kind of what those root causes are, especially with the rheumatoid arthritis. Okay, great. So I think we have a good picture of what an autoimmune disease looks like. And then let's talk a little bit more about that rheumatoid arthritis picture, and what would someone be experiencing if they were thinking, you know, I might be experiencing this. Do I have rheumatoid arthritis? What would be the differences between some of the other arthritis, like psoriatic arthritis or osteoarthritis, which, you know, I think some of our listeners might be confused by some of those different terms.
Yeah, sure. Like RA is basically a huge variety of symptoms. Usually it starts with something like morning sickness, not sickness, sorry, stiffness. But in a pregnant woman, it could be morning sickness as well.
Right, yes.
But the morning stiffness usually like in the small joints, like in the wrists or fingers or knees. And then they start thinking, yeah, okay, maybe I did too much yesterday. I had too much household chores done. But then the symptoms come back every morning. And I see many patients who tell me like, I'm so tired. I don't know what happened. And I had so much energy. I was able to do my work. I was able to have hobbies, to play with my kids. And somehow this changed. And they were like, when I wake up in the morning, I'm so tired. I don't know where my energy went. And like the energy thing is already a important component to see that your body has something to do in the back. So it doesn't produce much energy for your everyday task. And so we see a lot of fatigue. Sometimes I have patients who already were affected by depression. Like even the fatigue can go right into depression, and they come from their conventional doctors and are treated as a depressed person.
Oh, interesting.
But the root cause is upstream, and it's like, it's just the underlying autoimmune condition.
Mm-hmm.
And the rheumatoid arthritis attacks the healthy joints and tissues, as I explained before. And this ongoing inflammation, it could be that the knee is like double the size than usual. It's red, it's heated. You can feel that it's overwarmed, and and the joint movement is not like you're used to do, or able to use your shoulders, your knees, your everything. So yeah, those are the typical symptoms where you'll be like, oh, maybe I have something which is into the rheumatoid arthritis system. And mostly they go to the conventional doctor, and the conventional doctors is then suspecting something, is doing some ground blood work, I would say. And as soon as some markers show up, usually they are sent to a specialist. So they get some x-rays done from the wrists or the knees, but like the joint which is inflamed, to see if there are already some damages in the joint.
And I really liked how you added in that component of fatigue, because that's so common with autoimmune disease. It's like, it's almost like you were saying with that protection aspect that comes into play. The body's like, well, I have to protect, every amount of energy, every little mitochondria in the body. And so I'm going to then, it's like you're using the reserves. And I think that's one of the reasons why patients will come in with just like even just fatigue, as you said, or depression, and the other symptoms are kind of in the background. And then we discover like, oh, actually the background ones are what's causing the problem, or the root issue. And so when you were just discussing labs a little bit, so are there specific labs that can be done, one for autoimmune diseases? I know that's a big question because there's lots of different panels, but for rheumatoid arthritis specifically, I guess that would be a better question for you. I like when someone's going into their regular MD or allopathic doctor, would they, and they listed these specific symptoms, and then one scenario could be that nothing came up and then they're like, well, what's going on? Or two, then they can kind of be guided to, these are some specific tests that you might run as a functional medicine practitioner.
Yeah, the conventional doctor testing is more like to see if the CRP, like the C-reactive protein, is higher than normal, which is an indication that there is some ongoing inflammation. And the problem with all those rheumatic diseases is that we have some kind of lab marker, the Rheuma factor, but it's not positive in all of the cases. So you can even be negative on this conventional blood work, and you're going to be relieved, but in the meantime you're still in the rheumatoid arthritis spectrum, but with a negative rheumatic factor. So I think it's really, even for the conventional doctors, it's very hard to diagnose. So mainly they focus, are there some unusual factors, some antibodies against even cell, we call them ANA, which are against nuclear, like the cell nucleus, to see. But I see, like, for example, my patients, only 50% have a positive rheumatic factors, and all the others are more like a they check whether they fit into this conventional diagnosis. And if they don't, it's go, okay, so it's not this. In your case, let's dive deeper into this one. Your lab doesn't show any indication for this disease. Let's go for the next one. And sometimes they end up in my practice, and I'm the person who say, okay, so they are not sure whether you're lupus or if you're like have a thyroid problem, an autoimmune disease, or if it's even rheumatoid arthritis. But no matter what, we're going to treat the underlying cause of your problem, because even if you don't fit perfectly into, I would call them drawers of a cupboard.
Right.
for
Totally.
diagnosis. There are things going on in your body, like you mentioned before. It's like the immune system, if it's working and if it has something to do and to fight against, your whole body is working, needs energy, and this energy shifts from the plate, like even the digestion is usually not like it should be, because the body needs the energy for other parts, and to heal and to fight against something. So yeah. And this was about the conventional medicine, and you asked about the functional medicine labs as well, right?
Yes, totally. I know it was a lot of questions. Yeah. So you explained greatly what I really liked is that you just described how a lot of conventional medicine doctors, well, they won't see anything, right? Because they're, not to say anything against a conventional medicine doctor, but their view is more narrow when it comes to lab work. And because if A doesn't equal B, then it gets ruled out. And then the patient still has the symptoms or still is feeling horrible. And so then they say, well, how can that be?
Yeah,
how can I
totally.
how can I still feel horrible, have all these things going on, but you say nothing's wrong? Or the other side of the coin could be, you have this and there's nothing I can do. And I think that's what you were talking about earlier too. So, okay. So then my other question was, are there different functional medicine profile lab works that you do? Like you talked about, the rheumatoid factor testing for that. And that's great for people to know, like you can be negative, but you could still have that in your system because everybody's individualized, as you said.
Sure.
So are there any specific like functional medicine profile lab work that you would do to point you in the direction that someone would be having an autoimmune disease, specifically rheumatoid arthritis?
Not specifically rheumatoid arthritis, but basically, but we mentioned this before, we need to find out what's going on upstream. So
right.
That's our job. That's what we love most about our jobs. We dig deeper. And because we have so great advanced functional medicine lab testing possible at the moment, the usual tests I do with my patients are a proper stool testing to find out whether there's an inflammation in the gut, whether there's dysbiosis, meaning more bad bacteria in comparison to the good bacteria, if there is even an immune reaction in the gut. And it's a simple stool test. And I went to med school in Frankfurt for 6 years and they never mentioned something about a stool test. So I was like, okay, that's a new version to work on patients. But it's amazing because you give, like the test gives me information no other lab work will do. And I can even tell them, oh, you have an underlying parasitic infection, and that's causing your immune system to overreact the whole time. I know your trip to Mexico was 10 years ago, but the parasite is still residuing in your body. So like the stool testing would be one important part. And then I'm a huge fan of the organic acid test. I'm like, this is the best test in the world, I guess. It covers with a simple urine sample, you cover all those different body compartments. I can even say if the liver detoxification or the kidney detoxification part is working, or we mentioned the energy problem thing before. And if I can, with the organic acid test, I can see if the Krebs cycle, like the energy producing cycle inside every mitochondria, which is the power plant in every cell in your body, whether there are some problems, one enzyme is not working properly, and then the whole cycle stops. And the end result with this, which is ATP, which is it's our energy in the body, is not produced properly. And that's why they have symptoms. And so, like, as I mentioned before, one simple urine sample tells you a lot. Like the whole body disbalances show up in this single test. And even the neurotransmitter one, like in my RA patients who are also like from the conventional doctor diagnosed with a depression. And I have had patients, they were already on antidepressant meds, and then I do the organic acid test and see how the neurotransmitter, like the serotonin, dopamine, the norepinephrine and epinephrine, which they are total out of balance, and of course they feel like crap.
Right,
But
totally.
nobody, like the conventional doctor just sits with the usual blood work and like, okay, that doesn't fit into the system I learned
Into the box.
Yeah. So I don't know, maybe do you have a hard marriage? Is something in your work not working like it should be? And then you're like on the mental health part.
Totally.
This is like the main reason I could jump and cry and whatever, because people have to know that even if they are diagnosed with depression, what if it's not depression?
Right.
What if we dig deeper and find, like with the simple testing, that there is this underlying cause with all, like it's an ongoing process, and the body fights against, and all the disbalances in the body, we need to take care that they are going back into balance, because the whole body systems are connected like a huge spider web. I would say. I would like to, because if you change a little thing on this side of the spider web, the whole other spider web moves as well. So you can't treat one thing, like just a symptom, and put something on top of it. And then you think, oh, okay, now I did my work. It should work, but it's not.
Yeah. Yeah. Oh, that was great. And, one key thing that you said too was, someone can be experiencing depression, and it can not be like the root cause, like you said, of depression, but instead they're given antidepressants, which are, as we know, are really harmful for the system, and can, down the road or down the river, can have lots of side effects that can be really detrimental to the patient. And the other thing I really liked that you said was, looking at the other systems that can be out of balance. So you mentioned the digestive system, so key, right? Because we know everything comes from the gut.
Yeah.
But a lot of times we don't think about, oh, why are my joints hurting? Oh, it's because I have poor bacteria or I have a parasite. Like you said, that's great, because people don't think about their trips they had like 10 years ago, that the parasite could still be living inside, or the residue, like you mentioned. The organic acid test, that's such a key one. I love that test because it gives us so much information, like you said, so beautiful. And what are some of the other systems? So you mentioned the digestive system. Let's talk about detox. So you said the liver and the kidney systems could be showing up on the organic acid test. Can you talk a little bit about how those systems, or let's just pick one, like the liver or the kidney, whichever one you like to talk about, how when that system is out of balance, then that can show up as an autoimmune disease, and specifically rheumatoid arthritis?
Yeah, like I would start with the liver. Like on the organic acid test, I can see whether, because in the liver we have phase 1 and phase 2 detoxification pathways, and like a toxin where the body tries to get rid of, it starts in phase 1, and it changes this toxin into a even like more aggressive toxin. And then you have to make sure that the phase 2 takes this more toxic toxin is put, like, usually they put something on the molecule, so the body is able to excrete it during urine, or with feces, or even sweat. And like on the organic acid test, I can see, for example, if the phase 2 system is not working properly, because we see some markers that show that the body has a glutathione deficiency. And glutathione is like, it's an amazing component, and we need it all over the body, especially in like if the body is working with autoimmune diseases or other infections, even a small viral infection, the body needs more glutathione than usually. And so we have to make sure that if those numbers are showing up on the organic acid test, that we give the proper amount of glutathione, usually in supplement form, sometimes in IVs, depending on the numbers, so that the patient's detoxification system is able to get rid of all the toxins which are stored in the body. I mean, we have, like, there were a research study done, I think 3 years ago, where they got samples out of the umbilical cord of a newborn baby, and they had already 80 toxins in the blood, which is
That's
like,
crazy.
yeah, in the minute they were born. So this gives us a way to see if even a child has so many toxins at the moment it's born. Let's imagine how many toxins we have in our body and how
Right.
the overall toxic burden is for everybody in our environment. So it's really important that we make sure that not only the liver, but also the kidney detoxification is working properly. And we have all those, for example, for the kidney, we need some kind of amino acids so that those systems are working properly, and some cofactors. And sometimes this is the key factor in a patient.
Yeah. Oh, great. And so it sounds like if the detox system, let's say you're testing for the liver and you're testing phase 1 and phase 2, and you find out like, okay, those systems aren't working. So that would mean that they weren't detoxing their environmental toxins or whatever was coming into the system properly. And then they're having some kind of autoimmune disease or something else affecting the system. And
Right.
so do you do other toxification testing on top of that, like heavy metals or, things to, like, say, for instance, like, okay, well, it looks like the liver is not detoxifying properly. What would be that next step to see what the toxins might be?
Yeah, sure. I do even some I think you call it provocation urine testing, where you, for the heavy metals especially, where you give the patient some kind of pill before. So they have a urine sample before the pill and one after, to see how much heavy metals the body mobilize after the DMSA pill. And like in many patients, like usually it's more in MS patients, because it's in the brain and in all the neuro tissues. They have heavy metals where you're like, oh my goodness.
Yeah,
And
it
they were
stays
not
in the system, doesn't it?
yeah. And it's like the heavy metals love the brain, especially quicksilver. And for quicksilver, you have another name in the US.
Aluminum?
Not aluminum. It's Hg in the periodic system.
Oh, I can't think of what it's called. I'll think of it in a second.
Okay, but they love the brain, and those are where the symptoms are. And even like you do the proper lab testing at the conventional doctors and even the neurologist office, and they say everything is fine, your blood lab work looks okay, the MRI scans look okay, but they feel they experience brain fog, they are again tired, they have problems to memorize. And for me, like if I hear something like this in the first appointment, I'm like, okay, let's think about heavy metals, and let's think about mitochondria problems, because even the mitochondria in the brain, if they have to deal with heavy metals, they can't function properly. So this is where on a small cellular level, that's where most of the root causes are.
Yeah, it's when the tiny little cell, which they're so tiny, but they have such a big job to do, right? When they can't do their job efficiently, I talk to patients sometimes, it's like you have this clear cell with all the organelles inside working properly, and then it's like you have this phase, like a cover, like a cloud, like it covers the cell, and then things can't go in and out of the cell properly, right? Which I think is what you're talking about, having the heavy metals go into the cell across the blood-brain barrier, affecting the neurological system, which can be so detrimental, like you said, with brain fog and cognitive changes, which, it's so interesting because with a lot of autoimmune disease, the symptoms are very similar. So it can be very challenging for us as physicians and the patient to kind of navigate that world. But like you said, when we go down to the root cause, then we're working on the system, which I think is kind of one of the things you were really talking about. It's like system based. Like, is this system working? If it's not, let's get it working again.
Yeah. And
Yeah.
I mean, the results, I mean, you will have the patients in your practice as well, where they come almost bedridden, 25-year-old people who are bedridden, not able to work. They don't have any social life because they are tired all the time. They sleep 15 hours and still wake up tired. And I'm like, okay, let's dive deeper.
Right.
And then we start
Something's
with
not right.
Yeah. But they went from every specialist to every specialist, and everybody told them, yeah, but there's nothing we can do. Your lab works look fine. I can't explain. Maybe you're depressed, and then the vicious circle starts again. And I mean, I have examples where if you found the disbalances in the system and you start working on it, of course, it's not a magic pill with functional medicine.
Right.
It's like for a disease which has had 5 to 10 years to evolve in the body.
Yeah.
It takes a proper amount of time to work backwards on the symptoms. But if you reach those points where they start feeling like, and they call me and are like, hey, I was able to do some sport today, and I felt great afterwards. I'm like, okay, now again, when was the last time you did some
Right.
sports? Oh, 5 years ago. So I'm like, yay, we did it.
Yeah,
That's the
I
right
know.
Totally.
Totally.
And even
Patients forget, right? They forget like how long ago. You're like, oh yeah, I haven't been exercising for like 2 years. Like what?
Yeah. And even with the gut health, we talked about it before, like it's all connected. And even the serotonin level, which is the makes me happy hormone,
right.
60 to 7% of the production is in the gut. So if my gut is inflamed and in disbalance and is not working like it should be, of course, my body is not able to produce this amount of I feel happy hormone I need. And then it starts.
Right.
I'm getting depressed. I'm getting
So true.
tired. It's I'm going from one doctor to the other. They like the patients just feel hopeless. They are fatigued, then they feel hopeless because all the conventional doctors just tell them, yeah, but there's nothing we can do.
So true. I know. And it's heartbreaking, I think, to see patients who have been having something happen, like you said, for 5 to 10 years, searching for an answer, and I think many people are when they have an autoimmune disease, on a quest for an answer. There's not always an answer because it can be deeper. Like you said, it can be a root cause, and then as we're figuring out as detectives, like what is that root cause? But I think when patients discover that it's not them or they're labeled as something, I think labeling can be really detrimental for a patient. And, just like, you're just out of balance. So let's figure out what can bring you back into balance. I think if we could move into something, I don't know, a different way of communicating, and instead of labeling patients, because I think, who knows, maybe that will evolve into a new aspect of medicine. I try not to label patients, but it also can empower them, like you were talking before, because it can give them keys to figure out like, oh, I have this, well, that's why that's been happening. So some patients can feel it as an empowerment, but other patients can feel it like as a sentence, sentence, which I think can be really hard for their healing. I wanted to ask you about, so you talked about pharmaceuticals earlier. Can you talk about how a pharmaceutical can suppress a patient's actual innate ability to heal, and how it can kind of, mask what's really going on from that root cause?
Sure. Like for me, the problem with the conventional prescription meds is in the rheumatoid arthritis example, they start usually because of the pain in the joint. They start with some kind of like ibuprofen or like an NSAID, and this disrupts the gut function. So usually because most people don't go to the doctor right away if they experience some kind of joint pain. So most of them had already 6 to 12 months before they went to the doctor, where they took some over-the-counter meds.
Right, like anti-inflammatory.
And those are affecting the gut health in a horrible way, because it, in most cases, it leads to the leaky gut syndrome. And if the, like, which means that, like, if you have a garden hose and a hedgehog goes by and spikes into the garden, and you have all those little holes, and then the water comes out, and it's exactly the same in the digestive system, because if the gut cells are not like close together and they open up, what they usually shouldn't do, all the stuff from inside the gut is able to go directly into the bloodstream. And this is where the immune system is your first line defense. And again, your body loves you. This is the reason why it tries to protect you. And then the immune system goes like, woo, woo, we have to do something.
Right. Alert.
Yeah, red alert. And they start with producing all those antibodies and all the activating all the immune cascades to protect against. It could be a virus, it could be even some food, like if you have a food intolerance and then the food comes directly into the bloodstream, your immune system will be for the whole time in an overreactive state. And this is key for many of my patients. As soon as we dig deeper and find out, for example, that they have an underlying food intolerance, which is not a food allergy,
right?
But it's the kind of intolerance where you experience symptoms after digesting this particular food almost 3 days later, like hours and up to 72 hours later. And usually people are not able to recognize, okay, because 2 days ago I had this kind of food, I have a headache today and my joint pain is worse. So you can do this with which is a blood test, which is pretty unusual for functional medicine because it's blood and not saliva or stool or urine. But you can figure out what kind of food your body is attacking or working against to protect the body. And if you find those underlying causes and see that this is the main reason why the immune system is in this overreactive phase, you can try to calm it down. And the problem with this is like coming back to the conventional prescription drugs, sometimes if those disease modifying prescription drugs are not working, they use for flare-ups steroids.
Oh, steroids are so bad.
Yeah, like they can be life-saving in some situations, of course.
Exactly.
But if you use them long term, and if you like, it's just like you put a Band-Aid on a symptom, but the symptom might be covered a little bit,
right?
But the whole underlying disease is going on. It's still going on and going on. And this is what I try to explain my patients, because they come with, I don't know, 3 to 4 prescription meds.
Right.
And I'm like, okay, we have a lot to do. And then we start tapering them off. But of course you can't stop them. And I don't want to say that conventional medicine is bad or is not working, but it's just how they were trained. I mean, I was trained the same way. So if you would ask me 6 years ago, I would be like, what? Stool testing? What do you do?
What's that?
I don't know how to read the lab results. But as soon as you like put those Band-Aids on the symptoms, people might feel a little bit better. But then you have the next problem going on in the liver. And as soon as the liver function shows up badly on the lab work, they are like, oh, maybe we should change the prescription med. And then there comes another one. And I'm like, I know, but it's not helping against the disease. If you have a small cut in your finger, you put a Band-Aid on it, yes, and it heals on its own. But if you put meds on the symptoms of a chronic disease, especially autoimmune diseases, that we have no meds to help stop the disease. We just cover up those symptoms. And I think most people get this wrong. I mean, I got this wrong. I thought if I take my thyroid hormone prescription drug, my thyroid will work somehow for the rest of my life. And that because this is how we treat it. But of course, it's still my thyroid was still attacked by my body. So
Mm,
the function went down and down, and I need to taper up my thyroid medication. And
right.
it's the same with every autoimmune disease. I
Mm-hmm.
never saw a patient who could stay on the same medication for, I don't know, 10 years in a row.
Right. The same dosage.
Yeah, because
Yeah.
even with all those new medication, the pharma industry comes up every year, it's only covering the symptoms. And this is
Right.
like, that's the most important part, to educate people that
Yeah. So key.
it's not helping to stop the disease. It's
Mm-hmm.
just putting something on top of it, though you don't feel the symptoms. And
Mm-hmm.
I think this is key to most of
Yeah.
the diseases.
So key. Yeah. Like you said, it's just like a Band-Aid. And why would we want to, rip off a Band-Aid every day, put a new one on? It's never going to get any better. Right. And,
Yeah.
what you were saying too is so key. It's when patients are given one pharmaceutical that isn't addressing the root cause, they then have another symptom that develops in the systematic aspect of the body, like you said, the liver, which then causes another pharmaceutical to be brought on. And so it's like a cascade of pharmaceuticals. And then the body, it's like the not gives up, but it just like, like, okay, this is too much. I can't go on. Right. And that's usually when patients are coming to us as functional medicine practitioners to figure out like what's going on in the list of pharmaceuticals, where we're like, whoa, okay, we need to figure out like what's really going on here to help them get off of those pharmaceuticals that are sometimes they're really needed, like you said, but other times they can be detrimental to the health for sure.
Yeah. And I love how you mentioned that the body is like, oh my goodness, I can't take it. And this is what I try to educate all my patients on, is your body loves you, and you can use your body as a seismographic system.
Mm-hmm.
Because as soon as some symptoms comes up, even from some people, it's a minor symptom like a headache.
Mm-hmm.
And we know if this symptom comes up, they are like, oh, my body tries to tell me something.
Mm-hmm.
Let's dive deep into my body, try to find the thing. And sometimes it's something like they were not able to put proper boundaries to family members or in the
Right.
workplace.
Mm-hmm.
And it's just overwhelming the body. And the body tries to communicate with us 24 hours. And
Right.
that's amazing. I love it. But
Yeah.
we were trained even at a younger age, like I think even in the first 5 years of our life, we were trained to ignore this kind of communication with our body.
Right.
And to be like, yeah, but I have to be brave. I have to be strong. I have to not complain about anything. But it's, for me, the healing path and the healing journey is the opposite. We need to help patients, to educate them that they are able to feel what's going on in the body. And I love it if, as soon as you work with a patient over a period of time, like 3 to 6 months, and they find out which kind of food they were like throwing into their body for the last 30 years, but then they found out, oh, as soon as I eat this, I feel tired, I feel bloated, I get a minor headache, and then they're like, oh, now I understand what you told me. And I'm like, yes, that's exactly what I want you to feel. Because as soon as we reconnect with the body loves us even more. And that's so important, that you have not the balance, not only on those, like the body compartment we talked before with the organic acid test, but also the mindset and the spiritual connection with our body. Because if we don't focus on those things, we have this ongoing stress, and the body has no opportunity to heal and to reactivate the self-healing potential we all have in our bodies. Even if I'm, I don't know, 90 years old, I have self-healing potential in my body, and I can reactivate it, but I have to know where to focus and what areas are important to focus on.
Yeah. Oh, that was so key. I loved how you talked about, taking the time to listen. And I think when patients, especially with autoimmune disease, they get to this place where they've turned down the volume, right, of being able to listen to themselves and to the key messages. And, you know, as you mentioned, food intolerances are so key to people, and it's an easy way for them to realize something is off. You know, when I work with patients, I'm like, okay, we'll eliminate these foods, and then let's reintroduce them in one at a time. And then when they reintroduce, like, oh my gosh, you know, they can feel it right away. And that's like the best information, like you were saying. It's so valuable. It's like a diamond, you know, in their healing process. Cause like, oh, when I eat dairy, I can immediately have to run to the bathroom or something like that, you know? So like, okay, well, let's work on the gut. The gut obviously needs healing. When you were talking about, RA specifically. Now, I know it's kind of a strange question because we're working from that root cause, but are there specific things that patients can use from the alternative perspective? Like, what would be the top 5 things they could start bringing into their life to help with RA or help decrease the inflammation?
You mean supplement-wise?
Yeah, or any intervention, like a supplement or an herb or a hydrotherapy, whatever, any like specific interventions like you know, I know we're just talking about addressing the root cause. So it's kind of strange to go, but still from maybe if we're talking about from that inflammatory perspective, are there some main interventions that you love that you're like, okay, I've seen the results with this?
Yeah, sure. Like for me, one basic thing, and especially with the pandemic, it's going on, I'm like, my main focus, if I don't do the proper testing, is vitamin D, because vitamin D is so essential for the whole body and the immune system. And there are people running around. I had a patient with a vitamin D level of 5.
Oh my gosh. That's so
why
low.
are you able to speak? And the doctors are like, okay, we try to taper it up to 20. And I'm like, no, with an autoimmune disease, of course, it's in the normal lab value range, which comes back from the lab. But especially in autoimmune conditions, we want to have the vitamin D level much higher, because then the body is able to activate everything it has immune system wise. And so vitamin D is a main component, and vitamin C as well, because vitamin C is our main antioxidant, and we can use it for the adrenals, like for the adrenal fatigue. We need it in every cell to protect us against all those like the how do you
free
call
radicals?
them? Yeah, the free, thank you, the free radicals in your body. And like we talked about gut health half of the time, I guess. So a proper probiotic and a prebiotic together can do so much, even if people don't have the stool testing done, because we're not able, with the normal diet, we're not able to get the proper and the right bacteria to residue in our gut. And which leads me directly to food. With an autoimmune condition, there are like 3 things you can easily do, which is get rid of gluten, get rid of dairy products, and try to eliminate sugar, the industrial sugar. And if people like focus on those 3, like, of course, it's a 180-degree change for most of the the patient, but they see. I usually do it at a challenge. I tell my patients, it's a 21-day challenge. And after week 2, they feel so much better without any supplement, only with the diet changes, that they are like, oh, I never thought this was possible. And then I'm like, okay, now I have you where I want you to be.
Right, it's like, ooh.
And then we can go one step at a time to dig deeper and to work on all those other things. But those are key elements, in my opinion. And of course, stress reduction. They typically, those autoimmune patients are not the ones who can set boundaries. They are the one that like, yeah, give me more. I'm trying to do this. Give me more. And then they put so much stress on the body that the whole immune system doesn't work like it should be. And so what I also see in patients is, if they start with one autoimmune disease, usually over the next 5 to 10 years, there are 2 more autoimmune diseases on top of it. And ask the question why.
Right.
But of course, it's if you activate the immune system and it's in this overreactive phase, it's just a matter of time that the body gets another antibody produced, which is against another tissue.
Yeah.
So when they come and they're like, yeah, and my mother has already 3 autoimmune diseases, I'm like, okay, now I know.
Right. Now you can see the story start to unfold.
Yeah.
Yeah. And it's so interesting how the body has different layers where it's trying, it's like you're back to the beginning where you're talking about protection. It's like, okay, well, I've been sending this message out that this is going on and you haven't been listening. So I'm going to talk in a different level. with adding another disease on or another dysfunction and hope that you will listen. Right. And that's another thing you were talking about too, is opening up the doorway within to really listen to what's going on. And I think, like you said, just really taking the time with food is so key. When you can just do a simple, well, some people don't always think it's simple to eliminate foods, but eventually it can be simple when you start to realize how good you feel. I think, you see the results quickly with food. And sometimes with supplements, like you said, you don't always feel the results quickly. It can depend on the person. And if they're so, laden with toxins, so clogged up when all of the among trees, all the systems are blocked. When they're trying to put a supplement in, when the food is the key. It's like you can't put something in and expect it to do something to work when the system's not working. It's like trying to get a clock to the right time. But when you haven't turned it enough, it's not working.
And even with the gut health, if you try to put supplements orally into a patient and the gut is not working properly, how should the body be able to resorb the supplement? And so, as we were trained at the Institute for Functional Medicine, when in doubt, heal the gut. And we start with the gut.
Always start with the gut.
And even in the first appointments, when I have those typical poop talks with my patient, and they're like, my digestive system is working properly. And I'm like, okay, so how many bowel movements do you really have?
Right.
Every 3 days. And I'm like, oh my goodness.
That is not enough.
And this is not right. But people don't talk about it. And we're not educated that it's important to make sure that you have at least one proper bowel movement every day to get rid of all those toxins.
Right.
Because
at least.
at least, of course. But if it's still in the gut, like in the digestive system, it's going to be reabsorbed in the body. And then you have those amounts of toxin. And even if you're doing a colonic hydrotherapy and people are like, oh my goodness, I feel so light. I feel different. My
like brain a new person.
My brain is working. I'm like, yes, I know why this happens. And this is also with the lab testing a thing I love when I work with patients, that we are able to educate them with every lab result, because I see there is no value if I'm going to be the one is pointing out, like, do it like this and this and this and move on and be happy. It's the opposite. I want to take them literally by the hand and explain which lab value means, so they understand the body. And it's amazing if somebody goes through your own organic acid testing. Of course it takes 20 minutes or so, but afterwards you know what your body is trying to tell you through the organic acid test. And I love how people call me some weeks later, I'm like, now I understand what you were talking about, because I feel the changes. And this is like, now my mitochondria, I think they are working now. And I'm like, yes, they are.
Yes, they're working.
It's amazing. But this is all information that needs to go out there. And of course, like in the US, you are 15 years ahead of us in Europe. I mean, if you try to explain functional medicine to somebody in Germany, they're like, what are you doing?
What was that? Well, you're so wonderful, the work you're doing. I'm sure it's going to spread like wildfire now.
It should.
Yes. And I really liked what you were talking about with explaining the labs. A lot of times when, I'll go through, even if it's just a basic blood work with patients, and I go through everything, what this lab means. This is the organ that we're testing it for. And they're both, most of the time, they're just shocked because they're never explained that information. Like, and they say, wow, this is what this test does. I'm like, yeah, we're not just doing a test for nothing. We want to see how your body is functioning at a basic level.
Yeah.
Yeah.
And you mentioned it, like the function is key for us.
Mm-hmm.
It's not just looking at, I don't know, current lab values to see, okay, they look right or wrong. It's just, we use those kind of lab values who tell us, is the system working?
Mm-hmm.
Is it functioning or not? And if it's not, then we know where we can focus on with our treatment. And I mean, if I go to have my thyroid levels done, they are like, yeah, okay, looks fine to me. You're okay. The TSA level is okay. But then I'm like, yeah, but you didn't check the reverse T3, for example.
Right. Mm-hmm.
Yeah, but we don't need to check it. And I'm like, yes, you have.
Yes,
because,
please do.
Because if this thing is too high, I'm not able to use the T3, which is going to be produced in my body. And even, again, the energies is not coming where it should come from. So there are like major explanation problems in the conventional medicine part, I guess, but maybe because they don't have the time. Why?
Yeah.
They have 10-minute appointments, and I'm not able to do a lab result education on the patient in 10 minutes.
No, it takes way longer than that.
Yeah.
Yeah. But then the end results are so empowering, and patients have, like you mentioned earlier, when they have the power to make the change in their own health, it's just, like a river of energy and healing goes throughout their whole system and to their whole community, to their whole family. It's just like everything changes.
That's true. Yeah.
Yeah.
Because sorry.
No, go ahead.
Yeah, because it's all connected. Again, even the family, the spouse, the people, like the neighbors, everybody will feel the difference.
Right. Yeah, it's true.
And that's so important that you have the support. I mean, of course, it's a mean situation if you have a spouse who's not able to support you if you're going on an elimination diet, for example, and he's eating burgers and pizza in front of you, and you're sitting there with your,
you're like, don't do it.
Yeah, that's not working. But if you have, like, even your spouse, even if the person has no chronic symptoms at the moment, they will feel the difference.
Right. Yeah, it's so key. And having that support. And, a lot of my patients, when I'm doing some kind of elimination or dietary change, I say, well, who's the main cook? And most of the time it's the woman that I'm seeing. Not always, it really depends, but I would say that's more common for some reason. But it can be the man too. But then I'm like, okay, whoever doing the cooking, just cook the same food for everybody. And then everybody will feel the difference, So it's like, okay, if the man is cooking or the female or both women, whatever, whoever's cooking. And then, like you said, it's like they can start to feel the difference. And a lot of times it tastes so much better too. It's like when you eliminate this specific food group, you can really taste the actual food. Like, oh, that's what a carrot tastes like, or that's what a sweet potato tastes like. You start and your taste buds change. And I think that's the gut connection you were mentioning earlier too. It's like we're able to take the time to eat, take the time to feel, take the time to recognize the food and to realize it's what the good that it's doing in the system.
Yeah.
Okay, I'd love for us to switch gears and talk about your book. So the end of uveitis and macular edema, how to successfully address rheumatoid arthritis, eye-related symptoms, and more with functional medicine. Can you explain to our listeners a little bit about what the book is about and how they can find the book and receive the book for help?
Sure. Like the main reason for the book was, I was like, we need to find a way to spread the word with functional medicine. And so I decided to write a book. And my goal was to explain patients or future clients how this unusual doctor-patient relationship looks like if you're working with a functional medicine doc, what kind of testing we do, that we do this timeline thing at the first appointment where we are start like on the day you were born, even some weeks before, to let them know that it's nothing to be scared about. It's the opposite. And in my book, I prescribe the momentum process, where it's an 8-step process where it takes you from the first appointment to the last one, which is basically how to stay healthy for the rest of your life after we focused on your main symptoms. And so they get informations about the supplements. They might be the perfect one for their symptoms. They get information for the elimination diet, how the elimination diet is done properly, and how to reintroduce food, and to explain how important it is that you have sleep, exercise, mental health. Everything has to be in this balance thing we were talking about in the last hour. And so everything is, I try to make it as compact as possible, so it's easy to digest. It's not a typical medical language book. It's the opposite. It's so it makes it clear for the reader how we do the functional medicine approach and how we change the body on a cellular level. And I would like, the print version just went out, and to celebrate this, I decided that I would love to give your listeners my ebook for free, and they can go to, if it's okay for you, they can go to rheumatoidarthritsolution.com/book, and then they can download the ebook, and they have the opportunity to find out what about the momentum process I'm talking about, and about all the other stuff we covered today.
Oh, that's great. Oh, and I'll make sure I put that the link in the show notes and on the website, so people can find that easily. That's what a wonderful gift. Thank you so much.
Sure.
And also, what was I going to ask you? I lost my train. Oh, can you talk to us about, you have an online program where patients can learn more about rheumatoid arthritis and work with you. Can you talk a little bit about that too?
Sure. Yeah, because I know, like, the book is based on most of my rheumatoid arthritis patients, and I created, with the content of the book, I created this 3-month online program where patients have access to the content in the book and the videos and some handouts, and once a week they have a call with me, a Q&A call, so they have access over the whole 3 months to me, which is pretty important. And even the group thing, because there was group calls, is amazing, because you can see how much easier it is if you have some other clients or persons going through the same thing. And I love to connect with them and have the discussion, and it's amazing. Like,
Oh, group healing. That's a whole nother podcast, right? Yeah. But I love that. That sounds like a wonderful program. And what a great way for the healing to spread out when people are in that community setting and group healing. I love that. And I think that's one of our new ways of moving into healing, is to really, it makes it more accessible, and it's an unlimited access, right, to healing. The potential is so much greater, and unlimited potential of healing just multiplies.
Absolutely. Yeah.
Yeah. Okay. One last question. But first, let's talk about where people can find you. So on your website, and that's Dr. Eva, the website is Dr. Hasenbeck.de, right?
That's the German one, but the English one is drhasenbeck.com.
Okay, great. So there's 2 websites there, and I'll put those in the show notes as well. And then also on Instagram, you have the Dr. _Eva_Maria _Hasenbeck. And so they can find you there. And then also you're on Facebook too. You have a Facebook page, so people can find you in all different ways. And that's the Eva-Maria Hasenbeck.9, right? That's the Facebook. And so they can probably search for that in there. And I'll put that in the show notes too. We got all those. Yeah. Okay, wonderful. And then one last question. If you had an unlimited budget right now, what would you do with that money to have the greatest impact on the planet?
I would try to make a TEDx talk to reach as many people as possible, to give them in a 5 to 10 minute video the informations they need to access their self-healing potential. Because in my opinion, that's key. And it's so easy as soon as you recognize that there is a possibility out there.
Yeah.
Yeah,
Oh,
that would
great.
be perfect.
That's wonderful. You can easily do that.
Okay, I will
Yeah.
work on it.
Yeah.
Thank you.
No problem. Okay, it's been such a joy to have you on this show today. Thank you so much for your time. And I've learned so much. And I'm sure our listeners are going to be thrilled to learn more about autoimmune diseases and rheumatoid arthritis. And we covered a lot of great stuff.
It did. Thank you. It was great.
You're welcome.